So the second cause of hemolysis is hereditary spherocytosis. Hereditary spherocytosis, what happens in hereditary spherocytosis, that there is a defect in the skeleton of the RBCs, a genetic defect in the skeleton of the RBCs. What happens due to this genetic defect? Two things happens due to this genetic defect. One is that mm, the normal biconcave disc shape of the RBC is replaced by sphere-shaped RBCs. And the second thing that happens due to this genetic defect is that osmotic fragility of the RBC is increased. So a genetic defect uh, that is common in European people, and that is an autosomal dominant genetic defect. It can result in two abnormalities in RBCs. One is that the biconcave disc-shaped RBCs are replaced by sphere-shaped RBCs, and the second one is due to this change in shape of the RBCs, osmotic fragility of the RBCs is increased. Now, how a patient of hereditary spherocytosis will present to you? Hereditary spherocytosis patient will present with features of hemolytic anemias. And what are the features of hemolytic anemia? Again, jaundice, gallstones, and normocytic or macrocytic anemia, and a dark color urine. So these are the signs of hemolytic anemias, and with these signs and symptoms, every patient with hemolytic anemia will present to you. Then if the presentation of both hereditary spherocytosis and G6PD deficiency is same, then how we are going to diagnose it? The diagnosis is the initial investigation, again, in this case, will also be a peripheral blood smear and a complete blood count. A peripheral blood smear will show spherocytes. As we discussed in the previous lecture, that spherocytes, if they are present on a peripheral blood film, there will be two differential diagnoses that should come into your mind. One is hereditary spherocytosis, and the second one is autoimmune hemolytic anemia. Mean corpuscular hemoglobin concentration will be increased. So remember this point, this is specific for hereditary spherocytosis. Mean corpuscular hemoglobin concentration will be increased. This is a specific feature for hereditary spherocytosis. So osmotic fragility test is also done. Osmotic fragility test will be positive. What is an osmotic fragility test? Normally in normal RBCs, if the RBCs are exposed to varying levels of dilution of a normal saline solution, what will happen when RBCs are exposed to a diluted normal saline solution? Lysis of the RBC will occur. Normal RBCs, in normal RBCs, hemolysis starts at 0.5% NaCl, and hemolysis is complete at 0.3% NaCl. But there are some conditions which can increase the osmotic fragility. So what does increase osmotic fragility means? So in normal RBCs, you can see that this is a varying a degree of normal saline solution. This is 0.7, this is 6, 0.5, 0.52, 0.48, 0.44, etc. So these are normal RBCs, which are exposed to different concentration of sodium chloride. So you can see that hemolysis has started here and it is completed here. So normally the hemolysis start at 0.5% NaCl and it is completed at 0.3%. But you can see in hereditary spherocytosis or in autoimmune hemolytic anemia, what happens? This hemolysis of RBC start at 0.68%. So hemolysis start earlier than expected. It means a positive osmotic fragility test. So someone with the hemolytic anemia and increased mean corpuscular hemoglobin concentration and blood film shows spherocytosis and osmotic fragility test is positive. So what are your diagnoses? Two diagnoses you should keep in mind if these features are given, that is hereditary spherocytosis and autoimmune hemolytic anemia. Then how we are going to differentiate between these two causes of hemolysis, which has almost similar presentation and almost similar lab investigation findings. Spherocytes on a peripheral blood smear and a positive osmotic fragility test. So these can be differentiated on the basis of Coombs test. So the definitive investigation in case of hemolytic anemia due to hereditary spherocytosis or autoimmune hemolytic anemia is Coombs test. So if Coombs test is positive, remember that Coombs test is used to detect the presence of antibodies on the surface of RBCs. So a positive Coombs test means it is an autoimmune hemolytic anemia. And a negative Coombs test means it is hereditary spherocytosis. Because in autoimmune hemolytic anemias, antibodies are formed against the RBCs. So that's why Coombs test will be positive in hereditary in autoimmune hemolytic anemia, and it will be negative in hereditary spherocytosis. Is this point clear, everyone?
Can you please say that again? The difference between with this Coombs test.
So Coombs test is basically used to detect the presence of antibodies on the surface of RBCs. So out of these two, hereditary spherocytosis and autoimmune hemolytic anemia, which one will have antibodies against RBCs?
Uh, autoimmune. Autoimmune.
Yes, autoimmune hemolytic anemia. So Coombs test will be positive in autoimmune hemolytic anemia, and it will
Right.
be negative in hereditary spherocytosis because there is no antibodies in hereditary spherocytosis that are causing hemolysis. In hereditary spherocytosis, the hemolysis is due to a defect in the cytoskeleton. So that's why a negative Coombs test with increased osmotic fragility indicates hereditary spherocytosis, and a positive Coombs test with increased osmotic fragility is autoimmune hemolytic anemia.
Right.
So the management of hereditary spherocytosis is steroid therapy, folate supplementation, and splenectomy. Complication of hereditary spherocytosis, it include uh, hemolysis, prompt hemolysis. Hemolysis can be activated by viral infections, and the most common virus that is associated with hemolysis or aplastic crisis. Aplastic crisis means bone marrow suppression or inability of the bone marrow to produce uh, any cell lines such as RBC, WBC, and platelets, but specifically RBCs. So in Plab 1 exam, whenever you see a parvovirus B19 in the exam questions, you should immediately think of sickle cell anemia and hereditary spherocytosis because uh, most patient with parvovirus infection, parvovirus can cause bone marrow suppression, so it can cause a reduction of erythropoiesis even in normal people, in people without sickle cell anemia or hereditary spherocytosis. But in people with hereditary spherocytosis, And sickle cell anemia, this infection is more dangerous because the people with sickle cell anemia and hereditary spherocytosis, they are dependent on RBC production from the bone marrow in the form of reticulocytes. So if someone with sickle cell anemia or hereditary spherocytosis, they get a parvo virus B19 infection, they will develop aplastic crisis. So whenever you see parvovirus B19 in patient, then you will think of sickle cell anemia and hereditary spherocytosis. So what will happen in aplastic crisis? Normally, we have discussed that uh, whenever there is hemolysis in the body try to compensate it by increasing the formation of RBCs and release immature RBCs into the circulation in the form of reticulocytes. So normally there will be reticulocytosis in patient with hemolysis. But if parvovirus infection occur, it will suppress the bone marrow and bone marrow will not be able to produce RBCs. So hemolytic anemia with no reticulocytosis will be a diagnosis of aplastic crisis. So this was all about hereditary spherocytosis.
Wait, what did you say? Hemolytic
Remember
anemia? Anemia with no?
with a low reticulocyte count,
Low. Okay.
low, yes, low or no reticulocytes. It means
Right.
there is problem in the bone marrow. The bone marrow is suppressed due to an infection due to parvovirus B19. So you will label it, your diagnosis will be aplastic crisis due to B19 virus.
Okay.
So this was all about hereditary spherocytosis. Hereditary spherocytosis is a genetic condition, autosomal dominant, common in European people. It is autosomal dominant. That's why it affects the males and females both. While on the other hand, G6PD deficiency is X linked recessive, so it only affect males. G6PD deficiency is common in African people, and hereditary spherocytosis is common in European people. The diagnosis is made with positive osmotic fragility and negative Coombs test. And a peripheral blood smear will show spherocytes. A similar condition is autoimmune hemolytic anemia, which has spherocytes on a peripheral blood film and a positive osmotic fragility test, but a positive Coombs test as well, while the Coombs test is negative in hereditary spherocytosis. So if you want to differentiate between hereditary spherocytosis and autoimmune hemolytic anemia, the definitive or best investigation in this case would be a Coombs test. So parvovirus causes aplastic crisis in sickle cell anemia and spherocytosis. And if a female get a parvovirus B19 infection during pregnancy, it can cause aplastic anemia in the baby. So remember these three things about parvovirus B19 or Plab 1, that it can cause aplastic crisis in patient with sickle cell anemia, in patient with hereditary spherocytosis, and if a female gets this infection during pregnancy, it can result in aplastic anemia in the children. So peripheral smear will show spherocytes and oval jolly bodies.
Sorry, just one question. The patient who is pregnant is suffering from either sickle cell or hereditary auto.
No, no,
Uh,
no.
then if
Aplas- aplastic anemia is a different thing, and aplastic crisis is a different thing.
right. So if
So
she's pregnant and she developed parovirus infection, then that can cause aplastic anemia in children
yes,
without having like
yes, that can, yes, without having sickle cell disease or hereditary spherocytosis. The
okay.
risk of aplastic anemia in the children will increase if
Or
his or her mother gets parvovirus B19 infection. So crisis is different and aplastic anemia is different.
right,
We'll discuss aplastic anemia in the coming slides. For
right,
now, just remember that they are different things because aplastic crisis, it is self-limited. When the infection resolve, aplastic crisis will also resolve. In
right.
because it's a virus and viral infection usually take 1 to 2 weeks to resolve. So that's why it's a self-limited condition, aplastic crisis. While on the other
Okay,
hand, aplastic anemia is a totally different disease.
right. Thank you.
So another point about hereditary spherocytosis is that along with spherocytes, you will see whole jelly bodies. So we discuss Hens bodies and that were present in a peripheral smear in case of G6PD deficiency, and whole jelly bodies they are present in hereditary spherocytosis. Whole jelly bodies are basically remains of RBC nuclei. You can see that some of these spherocytes they contain a blue dot that is known as Howell jelly bodies. So this was all about hereditary spherocytosis. So we are done with the causes of hemolysis that are due to a problem in the RBC membrane or problem in the enzyme. Now we'll move inside the cell and discuss the cause of hemolysis that is due to problems in the hemoglobin.